Hi, my name is Brandon, and I'm going to be doing a skin, head, and lymphatics assessment today. So what I'll do is I will go to the patient's room, I'll knock on the door, and I'll say, "Hi, my name is Brandon. You're going to be your RN today," and I'll perform the hand hygiene. I'm going to be performing a head, face, and lymphatic assessment on you. Can I get your name and date of birth, please?
My name is Linus Limo, and I was born on 2nd May 1997.
Okay, so I will note that, check his bracelet, note it in, and confirm the patient. And after hand assessment, I will gather my equipment, which will be a stethoscope, a pin light, some water, and gloves if needed. So, after settling in and getting my patient's past history, I will ask them some questions for more specifications on their head trauma and injury. Have you had any head injury, Linus?
Not recently.
No head injury? Are you experiencing any headaches?
No.
Any pains in the neck or shoulders?
No.
Have you had any neck injuries specifically?
No.
Do you have any lumps or bumps or any protrusions anywhere that have popped up on your head? No? Are you on any medication?
No.
Nothing that would affect your head or your sinuses, maybe your migraine headaches?
No.
Nothing like that? Okay. So, after asking patient question and finding out what other information might affect this assessment, I will gather my equipment, set it aside, and I will start with the inspection. Just like the skin inspection, I will keep my hands behind my back, and I'm simply looking right now. First thing I'm going to look at is the face. And so what I'm actually going to look at is the symmetry of the face. I'm going to look at the eyes and the eyebrows and the folds of the nose and in the mouth. So I'm going to start with the eyes. The eyes look symmetrical. Looks like they're in proper alignment. The eyebrows as well. I don't see any deformity. With the nasal folds of the nose, the outer folds, they're properly aligned. I don't see any swelling or discoloration. With the mouth, same thing. It looks symmetrical. I don't see any sores or redness. And through all that, I'm going to be looking for any drooping, any asymmetrical features. I'm going to be noting his facial expressions to make sure that they're symmetrical as well. I'm going to look for any involuntary movements, any tics, any twitches in the face, which he doesn't seem to be experiencing any. I'm going to also look for pulsations on the temporal areas, particularly to be on the side of his head without touching them. I'm going to assess on the side of his face for the temporal areas and look for any palpations, any movement. Okay, I don't see any. I don't note any bruises or discoloration. And there's a certain thing when it comes to the eye specifically to look for. I believe it's called exophthalmos. It's when the eye actually protrudes out of the sockets. His eyes are symmetrical and healthy looking, and so they're obviously not popping out of the sockets. So after that, we will move on from the face to the neck. Next, we're going to look at the lymph nodes around the neck, and I'm looking for any swelling, any protrusion, any inflammation of the lymph nodes around the neck, and I don't see any. I don't see any redness. I don't see any inflammation, anything bulging out, anything sticking out. I don't see any pulsations in the neck either. There's no extra movement in the neck, and it doesn't have its own tics either. So I'm going to actually ask at this time if you would perform a few range of motions for me, range of movement for me, Linus. If you would move your head up and down. Good. If you move side to side. And he demonstrates a really clean, swift, easily. There's no breaking in his movement, basically. I'm going to assess the trachea midline. So if you look up for me, I'm going to look at the trachea going down and make sure it's in the midline. Now, I'm still inspecting, so I'm not actually touching him, but I'm eyeballing to see. It looks central to me. It doesn't look like it's going either way. And I'm going to ask you, if you look up again, if you would swallow for me. And you can see the movement of the trachea moving up as it should. So it looks like it is in proper alignment and there's no visual defects of it. So I'm going to inspect the glands next. I'm going to look at the parotid on the sides and his salivary glands, his sublingual and submascular. So I'm looking for any sort of inflammation on the side of his face for parotid and any under his chin for any of the submandibular. And if you would open your mouth and stick out your tongue for me, as wide as you can. Tongue up, please, sorry. I'm looking underneath his tongue for any swelling for the sublingual salivary lymphatics. So after inspecting those glands, last thing I'm going to inspect is his scalp. Still not touching anything, I'm just going to look at his scalp. I'm going to observe the shape. I'm going to observe for any deformities, any abnormal shape, and he's got a very good shape and normal size head. He looks very normal cephalic, which would be a normal shaped skull. And just sit up for me straight if you would, Linus, sorry. His head is midline in his body, so his head is, he's got a nice midline position with the rest of his body, so very nice position. I'm not seeing any swollen glands on his head anywhere. No, I'm not seeing any swollen glands or any inflammation, so I will move on from there. Now we're going to move to palpating. So first thing we're going to palpate is the thyroid gland. And there's two ways we palpate this. The first way is from the front, the anterior, and then the posterior. Starting with the anterior, what I'm going to do is, here's the thyroid going down. We go down from the chin down to the top of the cartilage. Here's the cartilage of the thyroid. We're actually going to go down a little bit lower to the subcartilage. And what I'm actually going to do once you reach is I'm going to put 2 fingers from the front. I'm going to actually move this trachea back and forth a little bit, make sure I'm in the right spot. And what I'm actually going to do is ask you to swallow. And I'm looking right now for any sort of abnormal movement, left or right, making sure it doesn't push one way or the other, that it's symmetrical. And it did feel very symmetrical. So that's from the anterior, from the front. So the posterior is pretty much the same. I would come up behind, assess the same thing. I could bring my finger up down his chin on the top of his cartilage, run it down a little bit further to the bottom of the subcartilage. And I put 2 fingers here. And then I'm going to ask you to swallow for me again. Okay, I felt equal movement, and I can even move the trachea side to side and palpate a little bit to feel the glands, see if there's any swelling, and they all feel very malleable. There's no inflammation, there's no hardness or stiffness, so it feels very healthy. The next thing we're going to assess is the face by palpating. So we're going to actually look at the temporal mandibular joint, the joint on the jaw. So what I'm actually going to do is I'm going to take 2 fingers up right in front of the ear where your jawline is, and I'm going to ask Linus to open his jaw up and down. And I'm feeling for movement, feeling for pops, feeling for any irregularity, and it feels pretty smooth motion. So I don't think there's anything wrong with that. Next would be the lymph nodes. So there are several lymph nodes, in fact, and I've printed out a sheet that we have on our PowerPoints. I will be assessing these, and I will be using this as a little bit of a guide as we go along because I think we're all still learning them. But I'm going to palpate the lymph nodes around his face and feel for any hardness, stiffness, move them around in circles to make sure they're malleable, they're elastic, because an unhealthy lymph node is a stiff, tough lymph node. So we're going to make sure that none of them are inflamed. So I'm going to start with the facial nodes. So I'm going to start up by the nose. Just move around. I don't feel anything there. I'm going to move down to the other, further down by the chin for the other facial node. I'm going to do the submandibular. There's only one here, so there's nothing there. I'm going to do the subclavicle, this is a submandibular, my bad. So, right by the thyroid, then underside, then further back. We're going to do the parotid, like we looked at earlier on the side of the face. So we're going to touch 2 fingers, feeling for elasticity, feeling for any inflammation. Then we're going to do the post-articular nodes. So back behind the ear. I'm not feeling any swelling or inflammation back here either. Now we're going to do some of the anterior cervical nodes, the posterior and the deep ones along the neck. So they've got several. So we're going to feel here in front of the ear and work our way down. Work our way back a little bit behind the ear. Not feeling any inflammation or swelling or hardness to note. Okay, and the last 3 we're going to look at are the clavicular, the ones on your clavicle, on your shoulders. So I'll take, in lieu of taking off a shirt for the one lymph node, I'll simply palpate along his shoulders, forward and back, feeling for any inflammation. And I'm not feeling any. All right, I think all your lymph nodes are properly healthy right now. Okay, so after palpating all the lymph nodes, next we're going to assess the head. So I'm going to assess the face just in general, looking for ridges, bumps, any tenderness or pain, smoothness, and texture. So I'm just going to, along his head, just kind of feeling. It's all pretty smooth. Not causing you any pain, am I?
No.
No pain? Okay. Nothing along your cranium either? No pain up here?
No.
Okay. All right. So I didn't feel any bumps. The patient experienced no tenderness or pain. He still has a very symmetrical and nicely shaped head. It's all normal clavicular. So next, I'm going to palpate the glands on his, we already did the glands on the next, sorry. I'm going to oscillate the thyroid. Normally, you would oscillate a thyroid to search for something called Brut. Not everybody's going to have Brut. It's typically when the thyroid is inflamed, it'll produce a whooshing sound. And so I will have sterilized my equipment, and we will use the bell end, the small one, instead of the diaphragm, the small one. And I will put it on the thyroid, and I'll be listening for a soft whooshing. And I'm not hearing any, so it doesn't appear he is having any issues with thyroid pertaining to Brut. So, next, we're going to wrap things down by looking at and assessing the cranial nerves. We're going to start with 9 and 10 because they're some of the easiest ones to do. So the first one, I'm going to ask you to drink some water for me if you would. And what I'm looking for is difficulty in swallowing. Did you have any difficult swallowing?
No.
Have you had any difficulty eating or coughing?
No.
If there is any issue with these things, it would lead to issues with the 10th cranial nerve, the vagus nerve. So next, we're going to assess the 9th cranial nerve, the glossopharyngeal. And how we do this is I will ask you to open your mouth, tongue out as wide as you can. I need to be able to see in the back. And I need you to say, Hard to see, but when he says the roof, the actual palate of his mouth rises up. It's just a kind of a reaction when you say and if it does that, then you know that the ninth cranial nerve is functioning correctly. So, and another thing to look at was the uvula at the time. It looked very midline. If there is a movement of the uvula, it can indicate other things such as skull fractures, possibly even lesions in the area. But his uvula was centered as well. It was a little tough to see, but I just caught that. Next, we're going to look at the facial nerve, number 7. To assess for facial nerve, it's simply having your patient be expressive in different faces. I'm going to ask them to perform some facial expressions. Could you smile for me? Okay. And can you frown for me? Can you show me an angry expression? And can you whistle for me? Are you able to? All right. And can you puff your cheeks out? Okay. And I'm actually going to do a bit of resistance here too, just to make sure. But I'm looking for symmetry in its facial expressions to make sure that it's not drooping or anything, because cranial nerve number 7 is often associated with, it was Bell palsy, that was it. It was partial facial paralysis often. So, looks like his number 7 is working well with the symmetry of his face and expressions. We're going to do trigeminal next. So I'm going to ask you to have movements of your mouth. So would you open your mouth for me wide and close it? And again. And close it one more time. Now can you move your jaw back and forth? Good. And I know this is tough, but can you slide it forward? Are you able to slide the jaw forward a little bit? I know that's a tough one to do. Yeah, there you go. Good job. If you're able to do all of these different motions, including this one here, if you keep your mouth closed, I'm going to put my hand on the bottom of your chin, and I want you to try to resist against it and open your mouth. Okay, good. You're able to open your mouth. And now the opposite. I'm going to try to hold your mouth open while you try to close it. So if you open your mouth for me, and try to close your mouth. Okay. He's able to fight the resistance and has the motor ability with the jaw. So his number 7 is working, or his number 5 is working properly, trigeminal. Last thing we're going to assess is cranial number 11, and that's the spinal accessory. And it's done very simply by 2 things we need to do. One, I'm going to actually stand behind him. I'm going to push down on your shoulders, Linus, and I want you to resist and go against him. And try to raise your shoulders. Ready? Okay, here we go. So there you go. Good job. So he's able to resist against that. The other thing is I want you to turn your head this way to your right, and I'm going to put my hand here and resist against your face. Try to go against the resistance. Good. And we're going to do the opposite side too. Good. This shows that the patient's cranial nerve number 11 is indeed functioning and well. This would be the last step in an assessment of the head, face, and lymphatic system. At this point, I would thank Linus for his time. I would discuss his findings. You don't seem to have any swelling, any inflammation of your lymph nodes. Your thyroid seems fine. Everything seems midline. You have proper head shape, proportions. You have really good functioning cranial nerves, good resistance, good functioning of that. And I'd ask if you have any questions for me.
No questions at the moment.
Okay, well, thank you so much, Linus.
Yeah, welcome.
And then I will perform hand hygiene and exit the room. And thank you so much.